Number 1. The Ottawa ankle rules. Radiographs of the ankle are indicated if tenderness along the tip of the posterior edge of the distal 6 centimeters of the lateral malleolus, tenderness along the medial malleolus, and or the inability to bear weight for 4 steps. Radiographs of the foot are indicated if tenderness at the base of the 5th metatarsal, tenderness at the navicular, and or the inability to bear weight for 4 steps. Number 2, test item cluster for a patient who would respond to spinal stabilization. Age under 40 years old, an average straight leg raise greater than 91 degrees, aberrant motion present, which includes catching when returning from flexion, painful arc in flexion, reversal of pelvic rhythm, and thigh climbing. A positive prone instability test. Go ahead and lie prone for me. Go ahead and lift your legs. Positive test is indicated if pain is only present when the patient is in the resting position. Number 3, test item cluster for a patient who would respond to spinal manipulation. Duration of symptoms of less than 16 days, no symptoms distal to the knee, or an FABQ work subset score of 19 or less. Hypomobility in the lumbar region or in the lumbar spine. And then at least one hip with greater than 35 degrees of internal rotation. Number 4, McMurray's test for meniscal pathology. Fully flex the knee, and to test the lateral meniscus, medially rotate the tibia and extend the knee. To check the medial meniscus, laterally rotate the tibia and extend the knee. Positive test is indicated if a snap or a clicking sound is present, often accompanied with pain. Number 5, the Lockman's test to test the integrity of the ACL. Knee is positioned about 20 degrees of flexion. Stabilize at the femur, and then you move the proximal tibia to look for excessive anterior translation movement. Number 6, the slump test for neurological dysfunction or tension. Go ahead and slump. Go ahead and straighten your knee for me. Any pain with this?
Yes.
Okay, go ahead and look up. That pain go away?
Yes.
A test is considered positive if the patient is unable to fully extend the knee or straighten the knee due to pain, and pain goes away when they relax and sit up and look up. Number 7, test item cluster for a patient with hip osteoarthritis. Self-reported pain or aggravation when squatting, pain with active hip flexion, pain with active hip extension, passive hip internal rotation less than 25 degrees, and then a positive Scour's test. Bring the hip into flexion and into adduction, and then move it into abduction. Test is considered positive if there is patient apprehension, notice the observation of abnormal movement, or if there is pain present. Number 8, Thompson's test, used to look at the integrity of the Achilles tendon. Squeeze at the calf. Test is considered positive if no plantar flexion is present. Number 9, favorite test for hip pathology. Put the patient's hip into flexion, external rotation, and abduction with their ankle resting on top of their opposite knee. With support at the contralateral AS-IS, gently apply pressure at the patient's knee that is up. If there is pain present, or the patient's pain is present, it's an indication of a positive test. Number 10, differential diagnosis between gluteal and hamstring weakness and a L5-S1 radiculopathy. For a diagnosis of gluteal or hamstring weakness, the patient would present with isolated weakness of hip extension, hip external rotation, hip abduction, and knee flexion, along with normal sensation. For a diagnosis of an L5-S1 radiculopathy, the patient would present with radiating pain in lower extremity, sensation deficits of the L5 and S1 dermatome patterns, myotomal weakness in plantar flexion, knee flexion, and great toe extension, and also diminished or absent Achilles tendon reflex. I'd also perform the straight leg test and the well leg test. For the straight leg test, you would start off on the impaired limb or impaired leg and raise it up with the extended knee. In the first 30 degrees, if the patient experiences pain or reproduces their pain, the patient's pain, it will be considered a positive test. Within the well leg test, you lift the unaffected limb, and within that first 30 degrees, if the patient reproduces the patient's pain on their affected side, it would be considered a positive well leg test, and also a positive self test.